Office says the House bill would cut $834 million from Medicaid. The Senate bill makes even deeper cuts by changing the Medicaid funding formula, meaning that states would essentially just receive less money. Joining me now to talk about the bill's impact, Avik, healthcare advisor to Mitt Romney's presidential campaign, also president of the Foundation for Research on Equal Opportunity, and former health insurance executive Wendell is with me as well, author of Deadly Spin and Nation on the Take. You know what, Avik, let me start with you because you posted something on Twitter a short time ago that caught my attention. I believe we've got the tweet. I want to put it up for our viewers and for our listeners. I'll read it to you. Finish reading the Senate health care bill. Put simply, if it passes, it will be the greatest policy achievement by a GOP Congress in my lifetime. Explain that for us.
Yeah, so think about a state like Texas. I live in Austin, Texas. Texas didn't expand Medicaid, but the tax credits in the Senate bill will extend to all the people who would have been eligible for the Medicaid expansions. You talked about these Medicaid cuts, the rollback of the Medicaid expansion. It's important to understand that that Medicaid expansion is being replaced by generous subsidies to help people afford coverage in the marketplaces, the exchanges, the private health insurance market. And that is going to provide better access to health care than Medicaid does, particularly in these big states like Texas and Florida where people haven't expanded Medicaid. So it's going to give states a lot more tools to cover the uninsured in their regions.
Wendell, is that true?
I obviously disagree so much. In my view, and I've been around a long time, used to cover Congress many years ago, and I've never seen a bill that's this mean and has so less heart than this one. It will be absolutely devastating for millions and millions of people, largely people who are poor. Yeah, they may be able to get some money to help them buy coverage, but a lot of these people who are able to get coverage under the Medicaid expansion just simply don't have the money to buy coverage in the first place. And I want to point out something else. Senator Johnson was talking about hoping the legislation to help people have insurance with lower premiums. And I want to make sure people understand that's classic misdirection. Yes, you can have coverage with lower premiums, and I used to see it when I was in the insurance industry. The way you do that is to cut benefits, to cut the value of those policies, or to make sure that people are having to pay more out of their own pockets for care. Yes, you can do that, but it means that the coverage will just be of far less value. So it's misdirection. Another thing, this bill doesn't do much for employers. In fact, neither did Obamacare for that matter. A lot of employers just simply are every year seeing year after year of continuing cost increases that predated Obamacare. Continues on. They're having to shift more of the cost of care and premiums to their employers. That's not sustainable, and that's why a lot of employers are coming together to finally push back against the insurance industry, which has proven over many years they can't control costs. One organization is being formed called Business Leaders Transforming Healthcare, and it's a representation of that. Warren Buffett said recently that rising medical costs are the tapeworm that is destroying American competitiveness. And his colleague, Charlie Munger, said it's time for us to talk about a single-payer system. So this may be the catalyst to get something like that going again.
Avik, I have not thumbed through the whole thing just yet. I just started making my way through it, but there's a section, and we talked about it at the top of the broadcast here, there's a section of this 142-page bill that was introduced this morning, and among the tax cuts, I mean, there's the medical device tax that would be eliminated, there's the tanning tax that would be gone, but there's also what appears to be a retroactive capital gains tax cut. Why would that be in this bill?
Well, Obamacare has a whole array of tax increases in it, so this bill repeals and in some cases delays the implementation of a lot of those Obamacare tax increases, of which one was an increase in capital gains tax. So that's what that's about. But here's something that's very important to understand. So when Obamacare was originally designed by Max Baucus, who was then chairman of the Senate Finance Committee, the idea was that everybody who would be newly insured under Obamacare would get their coverage through these exchanges or marketplaces that the Affordable Care Act set up. That changed, and they decided to expand a lot of the coverage through Medicaid because the Congressional Budget Office told the White House and Congress that Medicaid was cheaper than the exchanges, that it would be cheaper fiscally to expand coverage through the Medicaid program. Well, that's actually not turned out to be true. In reality, the exchanges have turned out to be less costly than the Medicaid expansion. So by putting more people on the exchanges and fewer people on Medicaid, but still covering people and providing them with generous financial assistance, this bill will actually do a lot to make sure that people whose incomes goes up and down, they can stay on the same health insurance plan, they can use the same doctors, they can get the same hospitals, the same networks. That's going to do a lot to improve the continuity of care, the access to care, and make sure that people who are really vulnerable get the best possible delivery that they aren't getting today.
Wendell, I would imagine you don't necessarily agree with all of that.
I don't. The exchanges have worked for a lot of people, but not for others. Keep in mind that a relatively small percentage of Americans get their coverage through the exchanges. It's important because it's where people go if their employer doesn't offer coverage. And in the old days, before Obamacare, it's where you would try to get coverage if you had a pre-existing condition and didn't get your coverage through an employer. We may go back to those days, but a lot has been said about some states now just having maybe one insurer on the exchanges. That doesn't mean that people don't have other access outside of the exchanges. But keep this in mind, too. I would rather have one insurer that sells quality coverage than 5 insurers, 4 of which sell crappy insurance. That's not good. People will be signing up for coverage that they think has value, and they find out when it's too late. It just doesn't cover what they need.
Avik, you would
that would be great if all else was equal, but all else isn't equal. Premiums have doubled under Obamacare over the last 4 years.
To be fair, Avik, premiums were increasing substantially before Obamacare.
Exactly.
Not by 100%. Not by 100%. So the premiums have gone up. The deductibles have skyrocketed. So a lot of people are saying, oh, the Republican plan will increase deductibles. No, the Republican plan is going to reverse a lot of the things in Obamacare that drove the premiums and deductibles up. Premiums will start to go down, and I think people will see this market actually, Wendell says it's a small percentage of people. Actually, the Congressional Budget Office said that 24 million people will be enrolled in the exchanges this year in 2017. It's only 10 to 11 million because the premiums are too high. So it's important to fix that.
All right. Avik Roy, former health care advisor for the Romney campaign, a big thanks to you. Wendell Potter, big thanks to you both. We'll have you both back on to continue the conversation. I imagine this is something we will be talking about substantially here for the